6 doctors, 6 specialities. 6 doctors, 6 specialities, and one clear message across all of them. ChatGPT is a tool, not a doctor. And the difference between the two is not just about knowledge. It is about judgment, context, and accountability.
One thing to remember here is this tool told a healthy young man he had lung cancer and sent him spiraling into fear, when the reality was something far less serious. These are not one-off cases. These are happening in Indian hospitals every week. Now, to help us understand where the opportunity lies and where the limits are, we are joined by one of India's most distinguished cardiologists, Dr. Ashok Seth. Thank you, Dr. Seth, for joining us today on Health Matters. Doctor, are you seeing the trend where patients come to you after already discussing their chest pain, their breathlessness, their palpitations with platforms like ChatGPT, Grok or Claude? Is that something you're actually seeing?
Oh, absolutely. I think we are in an evolving world. And right at the outset, I must say I want to differentiate between the social media platforms versus AI-integrated ChatGPT-like platforms. In fact, I actually say a lot of people, much more empowered with knowledge, with understanding, and with questions now, certainly, than ever before. And do I think it's good or bad is one of the things that we need to certainly discuss. But yes, and it's not the patients themselves, because if you consider my sphere of work, which is coronary artery disease, a lot of patients are in the middle elderly. But with each of the young elderly is a young man or a young lady who are so AI literate. You know, their children, their sons, the children, their nephews, nieces, etc. Or the younger groups between less than 50 are truly AI empowered. So we are seeing practically, I would say, 80% of our patients being either, and you can judge it by the questions that they're asking, that they've actually been on one of the AI platforms and known a lot more about their symptoms and coronary artery disease, etc.
Doctor, we all want to know your reaction when a patient walks in with a ChatGPT response on their phone. What goes through your mind as a doctor?
I personally don't think it's a dangerous trend, to tell you very frankly. Here's the spectrum that we see. We see let's take 100 patients who have been on AI, there's approximately 10% or 20% who are truly worried about their condition, over worried. Call them the cyberchondriacs, as we say. They are that anxious group of people who have an anxiety built in amongst them, usually, and then they are on the platform a lot. And they go into multiple platforms and deeper till they actually get what we call cyberchondriacs and unnecessarily too worried about something which is too simple and perhaps not even a disease process which they have. For example, a chest pain, which they think is going to be a heart attack and they're going to die in face of a situation which could just be a little muscular pain. Then, on the other hand, is another 20% Gen Z type, should we say. Very intelligent. They are absolutely amazing in terms of intelligence, but because of that, they truly become ChatGPT doctors themselves. So their questions relate to not just having more knowledge from us, but actually even telling us how we should do the treatment and therefore even how we should perform that angioplasty in a very complex situation. And they start discussing anatomy and the coronary arteries, and would you address the LAD? And I said, those are the ones where we have to finally stop and say, if you want to treat your relative or your father or your mother, then you might as well do the operation rather than have this discussion. And then there's finally 60% who literally, I feel, are rightly empowered. It makes us so simpler for us to discuss with them, answer the right questions, and for them to be empowered enough to understand the next steps for the treatment and for their outcome.
Right. Doctor, now I want to explore the other side of the story. Has a patient ever delayed coming to you because ChatGPT told them it was probably nothing serious?
I think the AI-enabled platforms, and they call it ChatGPT for the sake of simplicity, are truly more and more getting more and more accurate because they ask a number of questions. I have my own experiences around this. I also have been on ChatGPT for one of my relatives who had a problem and who had a serious problem. And I wanted to know more about it, and I wanted to know about how to go about it because it's not my domain, it's not my knowledge. It's a condition and a specialty which is totally alien to me. And I got so much of information because the ChatGPT took me through more information, wanted more accurate information before suggesting anything, was taking me through all the possibilities, and finally said, it'd be much better that you see a doctor as soon as possible, okay, for that situation. So I think these platforms are becoming more appropriate in the present terms. They're not static platforms. They continue to modify. So it's how much information we want to put it to them. But again, it's our fault if we start understanding that they are doctors and we start treating ourselves based on that.
All right. But also, doctor, we also want to know that what are your conversations with ChatGPT and what do you like to talk about yourself, or whenever you have doubts, are there doubts that you actually ask the ChatGPT, or do you use AI for your work overall?
Oh, I think they're very interesting. For example, I have asked ChatGPT things like, I have chest pain. What do I do? ChatGPT has actually answered that it could be a variety of reasons, right from simple stuff to a heart attack, and then has asked me as to what is the nature of the pain, what's my background, what's my age, what's my sex. And as I keep answering, it's now narrowing it down. And then if I say that I have chest pain on exertion, which goes away at rest, the ChatGPT says, you could have got, what's your background? And I say, I'm a 42-year-old. That's what I wrote in. I said, I'm a diabetic. It's right. You've got a high likelihood. Please consult a cardiologist.
Doctor, in the last few years, we have seen that young Indians are having heart attacks at 30, 35. They are also the most likely to consult ChatGPT first, as you also pointed out in the conversation earlier. Doctor, what is your message to that particular demographic specifically?
Yeah, I think you raise a very important point. See, every time we have kept emphasizing know your risk factors and understand how to control them in this world. We as Indians are prone to heart disease, especially in the young. And I therefore want all youth to consult ChatGPT for their risk factors. And all you got to punch in is, I'm a smoker, I'm a diabetic, this is my age, my father had a heart attack at this age, what's my BMI, what are my habits? And it'll just keep asking that. And by the way, it'll bring out, literally, tell us exactly what to do. And we here, by the way, waste time to try to get a doctor to tell us that we're going to take care of our risk factors and how. Well, prevention. The ChatGPT tells us very accurately. It actually analyzes, it actually tells us even when the statins have to be used. It also tells us that you're at a high risk, see the doctor. But importantly, can you believe that it talks on all matters and doesn't disregard anything because it goes by the guidelines?
You're absolutely right. Dr. Seth, your message is an important one. AI tools like ChatGPT can help people better understand their health and ask more informed questions, but they work best when they support, not replace the doctor-patient relationship. Thank you, doctor, so much for joining us today. So before we wrap, here are 4 things you should never rely on ChatGPT for when it comes to your health. 1. When it's about the heart. If you or someone around you is experiencing chest pain, breathlessness, sudden sweating or pain radiating down the arm, do not open ChatGPT. In fact, call an ambulance. Every minute in a cardiac emergency is critical. The window to save heart muscles is narrow and no AI tool in the world can substitute for emergency medical care in that particular moment. A delayed call because ChatGPT said it was probably acidity could cost a life.